From the News Channel 5 Network, this is OpenLine.
Hey everybody, Rhori Johnston with you here in the OpenLine chair on a Thursday night. It's been a while. Good to see everybody here on News Channel 5 Plus. A really important topic tonight that we want to discuss. Everyone is always concerned about children's health, not only your own kids, but children everywhere. It has been a major concern, especially over the last few years. So tonight, we're going to talk about the 2022 Vanderbilt Child Health Poll. Now, this is an annual poll, covers all Tennessee, gets a representative sample from all three of Tennessee's grand divisions, as we call them, to kind of find out what are the top concerns right now that parents have. We'll say that this poll was conducted in late 2021. So just a few months ago, the folks at Vanderbilt who conducted this poll are still disseminating information, but we're going to learn a lot about it tonight because we have the person who kind of directs this poll. We want to welcome in Dr. Stephen Patrick. Dr. Patrick, good to have you here. I know we were talking in this break that you've been on OpenLine before to talk about some other important topics, but thanks for taking the time after a busy work day to kind of break this down. I will say, Dr. Patrick, as you know, as we mentioned, this is a Vanderbilt poll. He is a pediatrician, a pediatric neonatologist over at Vanderbilt Children's Hospital, but he's also at the medical school there, an associate professor of pediatrics and health policy, and the director of the Center for Child Health Policy, among many other titles that he holds. He stays busy. Dr. Patrick, thanks for being with us. I'll just start off with this poll. Tell us a little bit about how you conduct the poll.
Well, Rhori, thanks for having me and talking about the poll. This is our third year of doing the poll, and for us, it's a way to take the pulse of what children and families are going through in Tennessee. We started this before the pandemic, but what we've seen are some of the effects that families have felt in the pandemic. This year, we started releasing this third year of releases, and what we started with were, this far into the pandemic, what are Tennessee parents worried about for their kids? What's their top 5 list? And we see pretty consistently what parents are worried about are schools, education quality. 2 in 5 parents are worried about that.
Right.
Bullying and cyberbullying, mental health and suicide, getting sick from COVID, and then missing school because their kids are sick from COVID. So here we are kind of this far into the pandemic, and you can see the fatigue kind of setting in with families.
Right. And you see there, some people, the ranking here, some people may look at like number 4 thinking, shouldn't that be higher? But when you really look at the overall, education and school quality, that is a concern, and we know that has been impacted by the pandemic. Then you go to number 3, child mental health and suicide. We know that has been affected. And then getting sick from COVID, then disruptions to schooling due to COVID. So I would say that this pandemic really is kind of weaved throughout your results, right?
That's true, and we saw that certainly last year too. Yeah. Last year we saw the first increase in uninsurance among kids in Tennessee in some time. And Tennessee traditionally has one of the lowest rates of uninsured kids in the nation, and last year we saw an increase for the first time in multiple years. We've also seen other effects too, like food insecurity. 2 in 5 kids are food insecure in the state of Tennessee, and that has only gotten worse during the pandemic. And so as in the now and in the next couple of weeks, we're going to continue to release data about what parents think, what their views are, what they're worried about for their kids, and again, to kind of check in with how families are doing.
And a lot of folks may hear that about food insecurity and say, well, how can that happen? Don't we have programs? We're feeding kids in the public schools now 3 meals a day, and there are food banks, and there are all sorts of different nonprofits, but obviously the tentacles don't spread out and get to everyone. There's a lot of kids in our state and a lot of different communities, right?
Yeah, that's right. So during the pandemic, we basically had a shock to the system, both a financial shock for many families,
Yep.
and then immediately kids weren't in school. And what that meant was that families had fewer resources, and then getting food at school became harder. There were several actions that were changed by Congress and here in Tennessee too, to make sure that kids could get food from other sources,
Right.
supporting food banks. But even with those supports, we see that that still there's a substantial
There's
amount
a
of
great
kids
need,
that were
yeah.
food secure. One of the things that we've seen in this though too is that when we ask parents, this program to make free lunch for kids. So right now, if your kid goes to public school, they can get free lunch. There's nothing else they have to do. They don't have to have income verification. 90% of parents think that should continue. That is the thing that more parents agree about than anything else we polled.
Yeah, and of course the supply chain issues, we've seen these schools doing their best to get some healthy food on the plates for these kids. I want to remind our viewers, obviously, as we discuss the results of the poll, we would love to hear from you. This is why we call it Open Line. We open up our phone lines at 737+. So call in and ask a question, give us a comment. We would love that. So you said the third year now. Tell me, as the years go by, why it's so important, because now you can look back, right? You have data to compare. So it's important to really keep this poll going every year, right?
That's right, and that's what we're going to continue to do. It allows us to measure things like kids, do they have insurance?
Right.
Do they have enough food? But it also allows us to check in on what's happening with families. So hopefully next year we're not going to be talking about COVID anymore, and we can move on to talking about other issues that families are facing. So you're right, it's good to have a continued finger on the pulse of what's happening for kids.
How is this poll conducted?
So it's conducted in a way, so it's a little bit more than 1,000 Tennessee parents with kids less than 18, and it's conducted in a way to be representative of Tennessee parents. So we use a panel that is sampled using census data
Right.
to make sure that we get a representative sample. This year we have representative samples from the 3 grand regions of Tennessee, as well as by race.
Yeah, so yeah, it's urban, it's rural, it's race and ethnicity, different ages. So you have this sample. When you talk about when you get the results, what is you want to look at some immediate results, and you're able to maybe make some judgments from that, but you have to really dig in and disseminate. That takes a while. How many people are digging through the results?
We're a pretty small team. There's probably about 5 of us doing this kind of on top of our other jobs too. So I think part of it is in the preparation before we do this. Are we asking the right questions that may be an issue now? So we sort of work to ask questions that may be relevant, particularly as like the legislature's meeting now to
Right.
potentially address some of the issues that we're talking about.
Yeah, I was just going to say, if I were a policymaker, I would want to take a good hard look at this information, right?
Well, that's the goal, in part because there aren't that many voices to elevate kids. And so that's really what we're aiming to do, to really elevate these issues that are so important to kids. Because just talking about it amongst our groups in the Children's Hospital, that's really not enough, right? We have to bring it to folks like you and to talk to the public and to policymakers directly that, hey, this is what's happening for Tennessee kids.
Were there any major differences, striking differences, maybe by areas of the state or ethnicity? Anything really that stood out, or generally did everything kind of look similar?
No, we look different in different areas of the state. So that's true for our poll release last week when we look at the 5 things parents are worried about. So for example, in West Tennessee, while education and school quality is the same across all of the grand regions, we see gun violence makes the top 5 in West Tennessee. Whereas in Middle Tennessee, you can see child mental health and suicide is elevated. And in East Tennessee, the region of our state that has been so deeply impacted by the opioid crisis, we see drug and alcohol use as something that families are really worried about. And that's important. We need to tailor our approaches to the kids that we're seeing in our communities.
That's a great graphic that we just had up, and I want to be sure to pull that back up when we come back from this first break. Again, callers, tell us what you think. We're going to take our first break with Dr. Stephen Patrick right after this.